Good evening, all of you. So, today we are having a special session on World Breastfeeding Week. So, as we are all celebrating the World Breastfeeding Week from August 1st up to 7th of the August, so today we are going to celebrate that session with having some informations and some important knowledge. So, let's begin with the session. So this is Rhea Biswas from FST and Exploration Foundation. So here first we have to understand why we are celebrating this week, why we are so much emphasizing regarding the exclusive breastfeeding, regarding breastfeeding. So what is actually the breastfeeding? So, breastfeeding is a process where actually a mother is feeding the infant with their own human milk, that is the through breast. So, this milk is actually.
Just a second, Rhea. Do the recording.
Yes, ma'am. Recording has been started.
Yeah. Okay. Thank you. Thank you.
Okay, okay. Um, So here the breast milk is actually ideal for that infant and a toddler because it is clean, which we actually heard about multiple type of milk are there in our market. So they are actually competing with the breast milk, or also they are providing enough knowledge that it is actually the what we say the substitute of a breast milk, but it is not exactly that. They are actually try to make it in a lab, but it is not that much enough for the baby as the breast milk, because breast milk is having multiple macro micro all the nutritional need a infant required. They have enough those things up to 6 months. So it is always recommended to have breast milk up to 6 months, and there should be exclusive breastfeeding where there should not be having any type of water, outside cow milk, or any type of powder milk. So it is not only for the baby but also for the mother. It is providing come back from that 9 month of pregnancy and the postpartum phase. So they help them to come back to their normal phase. So breastfeeding is equally important for the infant and the mother. So for today, this year we are celebrating the World Breastfeeding Week, having the theme of breastfeeding for a sustainable start in life. Okay, and which strengthen what works. So it is given by WABA, that is World Alliance for Breastfeeding Action, along with WHO and UNICEF. They are working for this World Breastfeeding Week, and they are actually doing various types of campaigns to create awareness regarding the breastfeeding. These awareness are not there in multiple areas, in even in the remote areas and the urban areas. Due to urbanization and globalizations, it has been seen that people are moving outside, people are working, that mothers are working. It's very difficult for them to breastfeed the baby up to 6 months. Maybe they are breastfeeding up to 3 months, then they go for their work and they introduce the formula feed. So in this whole process, it has been seen that the baby is suffering, mother is also suffering, the emotional connection is disrupted. Along with that, mothers the comeback, what I'm saying, it is hampered. So that's why it is always recommended that exclusive breastfeeding up to 6 months, and it should be up to 2 years you have to breastfeed the baby. Okay, so before going for the breastfeeding, first we have to understand how the milk is produced. So first and the foremost thing is sucking reflex stimulation from the mouth of the baby, which actually helps to signal in our body too. towards our brain, where hypothalamus is having our pituitary. That pituitary is stimulated, that the baby is having having the sucking reflex and giving the sucking, so baby need the food. So I have to prepare it. So there are two types of pituitary, that is anterior and posterior. So posterior pituitary secrete the oxytocin hormone, whereas anterior pituitary, which is secreting the prolactin hormone. Here the two hormone is having different role. So prolactin hormone help to produce more milk, and it is stored in the alveoli, whereas the oxytocin help in let down reflex. It helps in flowing of the milk to the mouth of the baby. Okay. So what happen here, when this stimulation happens, it go to the hypothalamus, then the pituitary signal, and the both the hormones is secreted from the pituitary. Then when prolactin first work, it produce the milk, enough amount of milk into the alveoli where it is stored, and then this oxytocin helps in let down reflex, and the milk flow to the nipple area, and through that it flow to the mouth of the baby. Then again, the one the alveoli is empty, it became the area is empty, so it is needed for the more production of the milk. Then again prolactin is secreted, so simultaneously the work is going on. So what happened, we have seen that if a baby don't have this and sucking reflex, or if they don't have the enough capability to do that sucking, this uh, total control, hormonal control, or this total process is hampered. Okay. So many babies has been heard that they don't develop this sucking reflex. So why it is happening, it can be the premature baby, or low birth weight babies, or there is some deformities in the baby, they having cleft palate, like this, these types of issues, we see that there is problem with the sucking reflex. So how this sucking reflex develop, it we have to understand that it is actually the inborn reflex which is there in the baby itself. It is developed around the week of 32 weeks in the gestation period, and when it is well developed up to 37 weeks, 37 to 38 weeks, we have seen the full development of the sucking reflex. And at the time of birth, the baby is fully functional, their sucking reflex is fully functional, either it is from the bottle they have to do, or from the breast. So what we see that one, when the touch stimulation is there, when the nipple touches the baby's lips, it actually develop the sucking reflex. Okay. And with the help of the tongue and the jaw, they do the proper rhythmic sucking. And if this rhythmic sucking is hampered, we have heard about improper latch. So if there is improper latching, there will be improper production of the milk, and gradually the production of the milk for the latter stage will be hampered. So it is seen that for the baby who are premature, their this sucking reflex is not fully developed. It is in the USG, it is very nicely visible in the 32 weeks of USG. If you are doing, you can easily visible into the monitor that there is the baby is sucking something, so they used to have the water from the womb. So they have that reflex, it is an automatic one they develop from the 32 weeks. So this reflex is very important and essential for their nutrition. Otherwise, milk can't be produced. So it is seen that if baby can't able to suck, milk can't able to produce. So it is the most important part. So when a mother introduce formula milk, we have seen that either initially baby won't take the formula milk because there is difference of taste, definitely. Along with that, there's a chance of infection can be there. And when baby is having that bottle, so bottle feed is having various types of bottles are there. So what we see in that, they suck and the milk will come into the mouth, it is very easy. But where in case of the breast sucking, it is very difficult because it can't able to properly, by continuous 3 to 5 sucking, they get the milk. Otherwise it will be very difficult to have the milk, because we are going through the process. But for the bottle it is not there. So gradually when you are introducing the bottle feed, the either two things will happen. First, baby don't try to suck for the more times. Second, the baby, your breast will not have that amount of milk production, so gradually the milk production will be lower down. So we have seen that after 6 months, when you are introducing a complementary feeding, which is very much important for the baby's nutrition and growth and development. So for that, we have seen that the breast milk production will be gradually reduced, and they don't need that much amount of milk. That's why your production is also lower. So it is important to have exclusive breastfeeding up to 6 months, because if you need to breastfeed, suppose 1 month you are feeding that formula, your gradually your milk production will be lower. So that's why it is very important. So here the importance of sucking reflex. First, they ensure adequate nutrition. Proper sucking, proper nutrition will be there. Along with that, they successful breastfeeding will be there. Promote growth and development of the baby. They strengthen their oral facial muscles. Along with that, it helps mother and the baby. Both of them are beneficial with this breastfeeding. And a proper sucking reflex is important for the production of the breast milk because of the two types of hormones, that is prolactin and oxytocin. Some of the factors which actually causing improper sucking, that is prematurity, birth, birth defect. There are many types of birth defect are there. Neurological disorders of the baby, like if a baby is born with autism and ADHD, there is issues with the sucking reflex. Sedative medication during the labor, if it is given, there is a problem. Cleft palate, if it is there, or any types of severe illness the baby is suffering from. So here are two things. One is rooting reflex, another one is sucking reflex. So rooting reflex is initially, which is very important, because baby can't able to understand where we have to use the sucking reflex. So you have to root it. So either the doctor or the lactation consultant, they actually helps the mother to make the baby understand where they have to actually root, where they have to, then they have to suck it. So locate the baby in a proper place where they can easily do the sucking. Okay, so for that it is important. So we usually say that a strong suck today, a healthier tomorrow. So why this is important? Because breast milk is having multiple amount of nutrients, and along with that they are having antibodies. Okay, macronutrient like carbohydrate, protein, fat, they are having proteins like casein, whey, which usually we obtain from the milk, immunoglobulin, lactoferrin, lysozyme. These are actually work as antibodies and helps in development of the immune system of the baby. So if a baby is continuously breastfeed up to 6 months, after that you will see the difference in two babies. A baby is having bottle feed or formula feed, and babies having breastfeeding. So what we see that the breastfeed baby having very little or minute illness, and it can they recover very fast also. But for a bottle feed, they are having multiple time, like stool clearance will be there more, loose stool. Along with that, they are having more allergies. So we can see these types of differences. Lipids, triglycerides, DHA, EPA, with that cholesterol is also there, which is very much important for the development of the baby and the brain development, which is very DHA. We already know that brain development and for proper energy balance we need it. Lactose is the energy boost for the baby. and human milk oligosaccharide which is present here in our milk, which is actually a prebiotic and helps for gut health. So gradually we will see that they are having very means normal clearance of the stool. And it is also said that if a baby is clearing 10 times stool in a day also it's okay, but if a baby not clearing the stool up to 10 days, that is also okay. So it is said in the initial stage, but after 5 months or after 4 months you have to check that the clearance of the stool is how much or not. Okay. Along with that, vitamins, all types of vitamins are present in the milk. With that, bioactive components are also there. Hormones, various types of leptin. Then we are having all types of adipocytes. These various types of hormones are there. Growth factors, cytokines, chemokines, microbiome, and stem cells. So this breast milk, or if we go for exclusive breastfeeding, it helps to protect your baby from the external toxins, external bacterial or microbiome. With that, brain development can be there, strengthening their bones, eye health, brain development, lower the obesity risk. Uh, in case of obesity risk, I will tell you that if you check the formula milk, you will get to know that there is so much amount of sugar, or what we say carbohydrate or calories, is present into them. So we have to if we tally with our breast milk, it is totally hell and ever difference. Okay. So even if you have that also, you will feel that so much sweet it is. So it's better, it will actually increase the risk of obesity, not in the initial stage, but after that definitely it will be there. And breastfeeding is actually help for mother's recovery and the emotional bonding. Emotional bonding can't be done by the formula feed. Why it is it is it can it, because you can do it with your anyone in your family, it can be done, but breastfeeding only can be done by the mother. Okay. So the emotional bonding is very much important, because mother is the one who is feeding the baby, and baby knows that the mother, what mother can give, no one can provide him or her. So let's move on to the composition, detailed composition. Here water content is 87%, whereas carbohydrate is 7%. So see, the carbohydrate content is so much less as compared to our other type of milks. So fat and lipids is 3 to 5%, protein 0.9%, micronutrient and bioactive 0.2 to 0.9%. So here protein, we are having alpha lactoalbumin, casein, immunoglobulin, which actually boost their antibody in their bodies, and help to prevent any types of cold, cough, illness, or any types of infection. Okay. With that, lactoferrin and lysozyme is also having antimicrobial effect. Lipids, we are having arachidonic acid, docosahexaenoic acid, triglycerides, and cholesterol. Carbohydrate is milk oligosaccharides, human milk oligosaccharides, with that lactose. Fat soluble vitamins ADE is present, and with that water soluble is vitamin C, and B complex is also present into them. Minerals like iron, zinc, calcium, phosphate is present. Rather, the infant is having enough amount of iron store, but still they are having minute amount of iron. Then hormone, leptin, adiponectin is also present, which actually helps the regulation of the appetite and metabolism of the baby. Growth factors is also there, cytokines, chemokines, microbiome, and the stem cells. So these are complete for a baby up to 6 months. Now look into the types of breast milk. Before going for the breastfeeding, here we have to first understand why these types of breast milk I am discussing. Because initial, the one which is very, what we say, that golden drop, we can say, that is cholesterol. That golden drop is actually came from 2 to 5 days and having maybe 1 to 2 drop, and it is having a very dark yellow color. So all types of milk is having different role, and it actually develop in different form. So that colostrum is actually very much helpful for the baby because it is very thick, very yellowish and rich in nutrient. So we will look into that part. So it's the nature's first gift, baby's first protection. So I have heard about few babies who are having developed this, maybe bilirubin is high, they have to kept in the UV light, and then some babies are preterm or they have to kept in some separate areas. They are given formula feed in certain hospitals and nursing homes. For them, what happened, the mother's colostrum is waste and they can't take it. So there will be chances of development of infection, development of allergies, development of various types of diseases. If this colostrum is 1 drop or 2 drop is also given to a baby, it helps them to recover from various types of diseases. So it actually come first, the first milk which is come from the breast, that is colostrum. It is dark yellowish and it is very thick. It is 2 to 5 days after you will have this, up to 5 days you will have this. So what happened here, it is the first immunization what we say, and a very small quantity. It is easy to digest for the baby and having natural laxative present into them. So the first stool clearance, that is the greenish stool they usually cleared after 1 to 2 days, that can be done with the help of the cholesterol. And with that, it is rich in A and E vitamins with protein, minerals and growth factors, and helps to build the strong foundation. So foundation is built from the first or to a second day, so that time it is there. So it is recommended after the consciousness of the mother, after the mother get the consciousness, means after the normal delivery within 1 hour they have to do the breastfeeding, or after the C-section delivery. So we usually recommend after the consciousness, the mother will come into the conscious, then the baby have to be fed. Okay. So colostrum is actually the strongest start we actually give. After that, we are having the transition milk. This milk is having more fat and lactose as compared to the colostrum, and water content increases, so it is becoming little bit slightly yellowish in color, and volume increases. Colostrum is very small in quantity, but the transition milk is having higher quantity as compared to them. Slightly yellowish creamy color. With that, the fullness of the breast will be there, because at that time they have a rush of supply of milk. Okay, so there will be fullness or heaviness of the breast they can observe. Protein and antibodies are gradually decreases as compared to colostrum, and vitamin minerals which adjust dynamically. So here and now, the mature milk. Mature milk is having two parts. First one is fore milk and second one is hen milk. It is actually they are having for the throughout the year and up to 2 years, and the years baby is sucking the milk. Okay, so the mature milk is the regular breast milk which is produced after transition stage, and 2 weeks after the birth usually we will see. So it is having 87% of water, 7% of lactose, 4% of fat, 1% of protein, and 1% of other minerals, bioactive components, vitamins, like that. So here we are having two part, fore milk, which is coming in the initial way. Okay, so when the baby is sucking, at that time baby will get liquidy, watery, more watery consistent of the milk, that is the fore milk. After sucking for certain time, they will get a thicker quantity of milk, that is the hind milk. The hind milk is having more fat content, whereas the as compared to the fore milk. Okay, So hind milk is comparatively more yellowish than the fore milk. Fore milk is having more watery content. So why it is important? It is actually giving the complete nutrition, support the brain development, boost immunity, and it is comparatively easy to digest. So what we see, some issues we see that the baby is not having enough weight gain. Still baby is having the breastfeeding. So what happened? Baby is sucking the fore milk, doesn't have the hind milk. So they are having the protein content, but they are not taking the more lactose or more fat content hind milk. So due to which their weight is not gaining. So that is actually a concern. The baby should they actually latch for 5 to 10 minutes, then they stop the latching, and after that they will latch after 2 hours. So definitely your uh, breast will not produce a hind milk at that time, then again fore milk will be secreted. So it is important to give cluster feeding. So cluster feeding is the feeding, the baby will suck for 10 minutes, then they stop. After 20 minutes you have to try for the baby to suck it, otherwise they can't get the hind milk and the weight will not increase. So regarding the weight increase, you will see the twice the weight will be increased by 6 months, thrice by the 1 year. So definitely you have to look to through this chart. It is not like that if your baby is having 3 kg birth weight, after that they are having 6 kg up to 6 months, it is totally idle. It doesn't mean that you have to make your baby fat and chubby. It is not necessary. Okay. So mature milk usually appears after 10 to 14 days of the postpartum. So you have to, this is actually continues up to 2 years to 3 years, how many years you are doing the breastfeeding, and ideal is up to 2 years. Now we will look into who guidelines for breastfeeding. So world health organization actually having some global guidelines for infant and the toddlers breastfeeding for their growth and development. So first one is early initiation. It is very important. You have to initiate early. It is not like that after, apart from the illness, apart from the any types of problem of the baby, you have to start within 1 hour after the delivery of the baby, the breastfeeding. Okay. So there should not be any interruption. Skin to skin contact should be there with the mother, and it is important. After that, exclusive breastfeeding, second one, that is 0 to 6 months, they have to have only breastfeeding. No other formula feed is recommended. Then after 6 months, introduce the complementary feeding, where you will initially introduce one small meal, then twice a day, two types of meal, then thrice a day you will have. Continued breastfeeding up to 2 years or beyond, which is recommended. And when you are feeding the baby, breastfeeding is you are giving the baby, don't introduce cow milk. Okay, cow milk is not recommendable for the baby. Now what are the practice we will look into? Responsive feeding. We have heard from our grandmothers, from our mother also, you have to feed the baby in every 1 hour. Okay, it is not there. If baby don't want to have the feed, then there's no need. So responsive feeding is important. Feed on demand. Baby shows hunger cues, then you will give them feeding. Baby is crying doesn't mean baby want food. Okay, baby is crying, maybe mosquito bite is there, maybe there is some issues or pain is there in the stomach. There, these are issues can be there because the baby is there in the womb, that is the most safer place, and now it is coming, he or she is coming in such an environment where drastic change is there. So they are facing emotional imbalances, physical imbalances. So definitely crying clues will be there. So you have to understand whether it is hunger clue or not. Okay, so feed on demand is important. It is not necessary you will feed the baby after 1 hour you have to feed the baby. That is not necessary. You can try. If the baby refuse it, don't give milk. Okay. Roaming in means mother and the baby should be there in one room together. In many hospital it is seen that the baby is taken to another room and they are given some numbers and all. So that is actually not according to the WHO guideline. You have to uh, keep the baby with mother only. Maybe in a other bed you have to keep the baby. Okay. Avoid pacifier and teats. So the pacifier actually having this nipple confusion. Okay, so it has been seen that baby will like the pacifier, not the original nipple or the mother's milk. So it is a chances of nipple confusion. So better don't give pacifier and other teats. So it's better to give them mother's milk only. Mechanical HIV guide, maternal HIV guidelines. So what we see that mothers living with HIV who are receiving antiretroviral therapy or any types of drugs or they are having, initiate breastfeeding for 6 months, continue 12 to 24 hours, 24 months. So what happened, we have heard that if mother is having illness, any types of illness, fever, they are having any types of like HIV, the one of the serious illness we will consider, other type of illness, all the type of illness, till mother can breastfeed to the baby. There is no issue with that. Okay, if there is no accident case. Okay. So maternal facility care is there. So 10 steps we have to consider. First one is policy. So International Code of Marketing of Breast Milk Substitute, we have to look into that thing, because it has been there, some code and conduct is there. You will see all the formula packets which is having breast milk substitute. It is written that mother milk is best. Okay. Why? Because they have to maintain the International Code of Marketing. Staff competency, any type of health workers, they should be competent to support and introduce the skill of breastfeeding. Antenatal care should be there, with that immediate postpartum postnatal care, where we see that skin to skin contact, these types of means all the lactation consultant, we have to consult those persons. Along with that, gynecologists, pediatricians, all should be there, where this delivery will be there, where mother is there. They should have these types of baby friendly hospital initiatives. So supportive mother or support mother, because sometimes it has been seen that mother's milk are not coming for 2 to 3 days. So it is totally normal. After 5 days maybe the milk will come out. So you have to support the mother. It's not like your milk is not coming, okay, give them formula milk. It is not like that. Okay. You have to try the baby to suck it, then they will be produced, and it takes some time. No mixed feeding will be there. Okay. Breastfeeding along with the formula feed, don't give those things. Baby will confuse. Either baby will choose one and or refuse the other. Okay. Responsive feeding is important. Rooming in is important. Avoid any types of pacifier. And community support means the family support, the friend support is very important over here, because at that time we see that the mother can't even properly carry the baby. Okay, proper positions are also important, so we need proper lactation consultant regarding this. Now, for complementary feeding, from 6 to 23 months, we have some advices that 5 to 8 food groups daily you have to give. Along with that, breast milk is important. Meal frequency from 6 to 8 months will be 2 to 3 meals per day. After that, from 9 to 23 months, we are having 3 to 4 meals with 1 to 2 snacks. Means normally what we are having, like 5 meals per day or 6 meals per day, we can have give the baby also along with the breastfeeding. Nutrient density, gradually we can increase, like maybe initially you are giving them half egg, then after that we will introduce the whole egg, like that you can introduce. Unhealthy foods, all the sweetened, All the more fat rich foods have to be avoided for the baby. Food safety and hygiene is important. Boil the water properly, then strain it with proper cloth, and use that water. Okay. Along with that, food should be, if whatever food you are giving, you have to use proper boil, have to cook it in a proper boiling water, or pressure cooking you can use. And the nutrient consistency you have to follow it every day. Iron rich food you have to introduce, because after 6 months an infant don't have that enough amount of iron. With that, some special circumstances or maternal health, like maybe some illness or sickness of the mother, so at that time we have to introduce formula feed. Otherwise, the other mothers are present into the hospital, we can give the breastfeeding from there. Okay. HIV ART protocol. So HIV mothers can give exclusive breastfeeding to the baby. There is no issues. Lactational anemoria method. So what we see that exclusive breastfeeding during the first 6 months, day and night, without long-term interval. So it is very much important, and acts as natural contraceptive with 98% of efficacy. So what happened when we usually say that the mother who is breastfeeding, they will not get their menstruation. Okay. So up to 18 months also there, some are having after 24 months, so that is totally normal. But you have to have a checkup with your gynac for their your better development. Okay. So let's move on to the steps, which is very important. First, prepare yourself in a comfortable area, means where you can lean down, lean back, having a pillow in your lap, then place the baby. Because after, if you can't do that, you will have back pain. I have heard about from many mothers that they are having this back pain due to that syringe, or due to that injection has been given, that is that local anesthesia. But that is actually not the cause. The cause is mother usually means they step forward and feed the baby. That is not the actually proper way. You have to have some back support. After that, you put one pillow in your lap and put the baby on that. So then you first, you initially you have to do the rooting, because baby have to have proper rooting, means where they have to suck it. If you suck, if baby suck in the exact nipple, that is not the area of sucking. They have to suck it from above that. Okay. So comfortable and effective positioning is important, and after sucking for 1 minute, they will gradually have the milk. Initially they will have that problem, but after 3 to 4 months they are actually expert in sucking, so they know where they can get the exact milk. Okay. So proper positioning is important, and after that you can heard one sound of gulping. Baby is gulping the milk. So there will be no issue that okay, baby is gulping. Sometimes it is seen that baby is not gulping, they put the milk in the mouth and they vomit it. Okay. So there are issues. Then sometimes baby gradually birth, which is actually one of the important thing. So for this step of breastfeeding, we are having some tips, that is feed on demand. Seek support. Support is important. If you need support, ask your family member. Skin to skin contact is very important. Don't put any type of cloth and means barrier between the mother and the baby. Okay. With that, we are having the breastfeeding position. So many types of positions are there. First one is cradle hold, where you hold the baby like that, means in your two hand you're holding the baby. Second one is cross cradle, where one hand is in the breast and another one is for the baby. Third one is football hold is there. Another one is side lying. Side lying is usually preferable while you're sleeping. And another misconception we have heard that if you're side lying, with the side lying position you are breastfeeding, it has seen that baby is having ear infection. No, it's a myth. Okay. So baby don't have ear infection. For that there is no connection with that. Okay, with that food pipe there is no connection here, so there is no such it's a totally a misconception. So you can easily with your proper, or what we say, according to the time your positions will be there, you can easily breastfeed the baby according to these positions. Okay, so sign of good latch, what we see, the baby's mouth is wide open, it's not closed. Okay, it is open, it's not like, not only the lips they are using, they have to use the full mouth, the lower lip turned upward, and with that the chin is touching the breast. Okay, so it is actually the proper good latch we see. Slow and deep sucking, and there will be no such pain. Okay, I will discuss the myths and facts, it is also important for that. So correct position is important for proper milk secretion, proper latching, and sore nipple can be prevented, any types of cracks in the nipple can be prevented, and breast feeding will be enjoyable for both baby and the mother. There will not have any types of pain in the breast. So initiation of the breastfeeding from 2 to 3 months. Shay, you want to ask something? Okay.
No,
Uh,
ma'am. Yes, yes, ma'am.
yes.
मैम अभी जो आफ्टर 6 मंथ हम कॉम्प्लीमेंट्री फूड देते हैं, फॉर एग्जांपल हमें नाशनी का बनाना हो तो हम वो वाटर में यूज करते हैं, वो हम दूध में मिला के दे सकते हैं क्या?
हाँ, दूध में मिला के आप दे सकते हो, बट
पर कौन से दूध में?
यू कैन यूज योर ब्रेस्ट मिल्क, ब्रेस्ट मिल्क यूज कर सकते हो, विद द पंप यू कैन पंप इट,
मैम
यू कैन यूज इट।
मैम नो, बेबी ऑन फॉर्मूला मिल्क।
फॉर्मूला मिल्क भी दे सकते हो आप, दैट्स अपॉन योर चॉइस। ओके, सो आई एम नॉट saying that formula milk is
ओके,
bad. Okay, but breast milk is one of the best option. If you are giving any types of food, you can use breast milk.
ओके मैम।
So here I'm discussing about the burping style. Okay, so why we have to burp the baby, otherwise what we see, there will be colic pain in the baby, so they are having severe stomach pain. What we see, that when a baby is having the sucking reflex or having the latching, there some air is coming, means air is going to, from the food pipe, the air is going, so the air is filled in the stomach. If you're doing proper burping, then they will burp and the air will be come out, so there won't have any types of pain in their stomach. Okay, so these are the positions of the burping. So you can take the baby in the upright position and burp it in their back, and you can down your you can if you see my video, it will be better for you to understand. Take your baby like in the upright position, and tap in the back, and just pull your hand like in the downward position. So it is one type of position you can use. Another, you see here, the mother is taking the baby in the full back, and they are just tapping it. We can do that, but we usually avoid it for the very just the newborn one, we usually avoid. For the newborn, we usually do this back tapping just. And the one is sit the in the lap, make the baby sit, and just hold their chin like that, and do the tapping in their back. So it is also one of the method. Another method is just you have to put the baby stomach downside, and in the back you have to tap it. So in the four positions you can do this burping. After 6 months, according to my experience, I am saying after 6 months the baby will gradually burp. If you take after feeding the baby, if you take the baby, just put it in your shoulder, you will see they gradually burp, so you don't need to do the tapping more time. Okay, burping is very important, otherwise you will see the colic pain. And with that, you will see here is our here are some other positions also. So complementary feeding, when it is begin, you will see gradually baby will born. Okay. Now some myths and facts we will discuss. Breastfeeding should hurt. It is a myth. Okay. Because if you're in the initial stage, there will be a problem, because baby is having the sucking, and your milk is starting producing, and it is produced from the breast, released from the breast, so there will be mild pain, but no such very means paining and cracking of nipples, it won't be there. Another thing is, after 7 to 8 months, you will see the baby is having the teeth, so they may bite. So for that, maybe there is sore nipples and there will be crack in the nipples. Otherwise, the breastfeeding is should not hurt you. Okay. Breastfeeding come naturally to everyone. It is not the thing. It is a learned skill both for the mother and the baby, because if you're not having proper diet, if you're malnourished, if a mother is malnourished, there will be not enough milk for the baby. Okay. If a mother is more aged, like after 40, 45, there is a chance there will be no such milk production for the baby. So breastfeeding is not natural. Okay. It is a process. You have to have proper diet, like you have seen in the RDA chart. For mother, the nutritional requirement is much more in the case of in during the lactation period. So mother should have enough amount of calories, because a breastfeeding whole process is having 3 to 500 kilocalorie loss. Okay. Now small breasts produce less milk, it is not also a concern. It is a myth. It is a fatty tissues. It's not a gland. So if a small gland produce small hormones, it is not like that. So milk producing doesn't need shape and sizes. If breasts don't feel full, supply is low, it is also not there. Supply increases with more sucking. Okay. You cannot breastfeed if you are sick. I also discussed that it's a myth. Cold, cough, flu, stomach bugs, anything you can feed the baby. You must eat a blunt diet. It is actually, I have heard after my delivery that you should not have any type of oily food. You should not have any type of outside fatty food. You should have only the home based very low masala wala khan. Okay, low masala food. So it is not at all recommended, because it is only for you. Yes, definitely you have those food which is nutritious. Okay. So if you want to have chicken, you can have chili chicken, there is no issue. But there is one thing, that if you have more spice, more chili, or more spicy rich food, it can reduce your breast milk production. Okay, because it may trigger like caffeine. If you're having higher quantity of caffeine, means having a 5 to 8 glasses of coffee, so definitely your milk production will be reduced. But that doesn't mean I can't have 1 cup of coffee. Okay. So this is important. It can upset your stomach, but it can't actually hamper the baby. I have heard one myth that if you are having spicy food, your baby's stomach will be means upset. Okay, baby will have loose tooth. So that is also a myth for a mother. So you can have you should have a balanced diet. With that, different types of food you can definitely include. It doesn't mean that no oil food, no sugar food you will have. You must wait hours to let breast fill. It is not also a question. It is not also there. It doesn't need hours to fill your breast. Yes, Medha, you can ask your question.
Ma'am, we have a myth of this also. If we eat sour fruits like lemon or oranges
Hmm.
or even banana also, so the baby will get cough and cold, ma'am.
Yeah,
This also myth
these
I'm
are
facing.
various myths are there. These are totally a myth. uh, so what happened for me, I'm telling. After having this means everyone is saying me just have boiled food, this so and so, these things. After that I have to go to a pediatrician with my husband, and I ask him. I already told them, no, this is not a thing. I already studied so many years. I am studying this. Means I am in a nutrition sector. So why you are showing that? So they are not listening to me. So I have to go to pediatrician with my husband. I ask them same question. Pediatrician totally laugh at me. Okay, so he said that all the mothers suffer. So nowadays they are also make others suffering. Okay, so like these types of things are there. So these are myth. Actually it's a myth. Awareness is important. That's why these campaign, that's why these seminars are very important. Okay, so formula, another one is formula supplementation ruin breastfeeding. It is not the thing. You can have calcium supplementation, you can have iron supplementation, because at this time, at this stage, calcium leaching is there from the bones if you don't have enough calcium in your diet. So if you feel that you are not having enough calcium, you can have calcium supplementation, you can have vitamin D supplementation. That is that won't cause any issues to your milk production. Okay, rather it will actually improve your milk production. Now the essential indicator. So how you will understand the baby is fully fed? Okay, first one, diaper output, or the baby is actually having wet diaper, or wet what we say cloth, we have to check that. So it should be more than in a day, more than 5. Okay, proper bowel movement. So bowel movement in the initial stage it will be not there. In 1 week maybe baby is having stool clearance. So that is not a concern. Weight gain, proper weight gain. It is not like just I put the baby and oh he is not gaining so much weight. You have to put in the weighing balance and check it. So proper steady weight gain we have to check. Feeding behavior, how what is the behavior after feeding? So after feeding the baby is sleeping soundly, or baby is more active or not, you have to check that. Baby's appearance and satisfaction. So with that you will understand if baby is sleeping properly, if baby is responding, if baby is active in your whole days, and then he is totally fed with the for, means your milk is enough for them. Now we will understand the advantage of breastfeeding for mothers. First one is faster recovery from the postpartum. So uterine contraction. So your uterus is larger, right? When your baby is there, after the uterus shrink very little. You have many mothers. You will see that they are having this larger stomach after the baby because of this uterine. So uterine contraction will increases with the oxytocin release. So you have to have breastfeeding for this uterine contraction. Reduce bleeding means after that if you're having the postpartum hemorrhage, the blood loss will be reduced if you're consistently having this exclusive breastfeeding. Reduce long-term risks and types of cancer risks, cardiovascular risk, or bone health. Can be, these are this risk can be reduced if you're having a long-term or exclusive breastfeeding. Weight management, weight will be reduced because you are losing 300 to 500 extra calories per day. If you are losing 1000 to 2000 kilocalorie, extra 300 to 500 calories you are losing. So for that uh, you your weight is totally managed after that. And metabolic rest, so burn, it also helps in burning of fat also. Emotional bonding is there, mental health support. So hormonal support, oxytocin, prolactin is released with the sucking reflex. So there are what we say, the connection with the baby. So mother is having this connection. And another term which is very important, and every mother actually go through that, that is postpartum depression. At night you don't have proper sleep, at day also you don't have proper sleep, you don't have proper, your weight has put on, you can't, your old dresses are not fitting on. So with that you are having multiple depressions, right? Your days are not like that before. So this depression can be lowered if you see your baby is fully fed and actually active every in all day. Okay, now we have to look into the importance or the advantages for the babies. So for babies, I already discussed many, but now some few things we will discuss. It strengthens the immunity, brain development, their growth will be developed, growth sprout will be there, proper digestion, absorption, risk of allergies, risk of illness can be reduced. Complete nutrition is given through our breast milk. Antibodies, first antibody the baby is obtained from the mother through the breast milk. Improve the sleep, comfort, and enhance the emotional bonding. Along with that, oral health, safe and convenient, economical. See, breastfeeding is actually economical. Okay, it is environment friendly, it is sustainable. So that's why breastfeeding is actually enhanced. Okay, so what we see here, why the breastfeeding is sustainable. According to SGD2, that is zero hunger, if a mother may be low from the low economical group, from the higher economical group, if they breastfeed, exclusively breastfeed up to 6 months, baby get enough nutrition for their whole life. Okay, so for with that breast milk, it is perfect for the infant to support their growth and development and prevent from any types of disorders. So it actually uh, having the sustainable development goal, that is 2, and zero hunger. For 3, that is good health and well-being, it promote good health and well-being, definitely. Sustainable development goal 5, that is gender equality, where breastfeeding empowers women and improving their health, along with that reducing healthcare cost. A milk you are buying, it is actually costly, formula milk is costly, it can't afford by everyone. So breast milk is free and economical for the babies or for the mothers who can't afford those things. So it can they can easily help to balance the family life along with the baby. SGD 10 goal, that is reduce inequality, that is breast milk always available, affordable and safe. It ensures every baby everywhere get the best start of the life. Okay, reducing inequality. So there is no such thing that this can be achieved by the female, this can be achieved by male. So that is not there. So every baby, whether female, male, any type of gender, they can have the milk from the mother. Climate action. Breastfeeding is natural, so they don't need any types of environmental changes, doesn't affect breast milk production. So with the generation, yes, one thing, um, your female cycle, with that what we say menstrual cycle, yes, it is important for breast milk production. Also your health is important for breast milk production, but for sustainability, breast milk is actually, or breastfeeding is actually promote this sustainable development. Now it is environment friendly because it is having minimum carbon footprint. It does zero, means you don't need industries for production of the breast milk, you don't need transportation, you are preserving various types of natural resources. With that, mother nature is preserved, and zero packaging is needed, zero plastic is used, zero pollution is there. So sustainable living is there, cost effective, improve the health of the person, along with the improve the public health. So we are not wasting any nature's environment, any types of environment resources, any types of pollution can't be occur. No such industrial support is needed for breast milk. So why we will go for formula milk? It is important to breastfeed the baby up to 6 months, when it is free, cost effective and economical, and most important, it's beneficial for both baby and the mother. Okay, now where we have to support the mother, it is very important. So first 1000 days is the vital window for the healthy future. First, strong immunity can be built with the exclusive breastfeeding, brain development and lifelong health. So from the womb of the mother, the baby is growing up to the 2 years, 3 years, 5 years, up to how much years you are feeding the baby. It is important for them. During the pregnancy, you are having enough amount of food for the growth of the baby. After 0 to 6 months, you are exclusively breastfeeding, strengthening their immunity, improve their growth and development. 6 to 24 months, you are giving them continued breastfeeding, no other milk, no formula milk, no powdered milk, no cow milk, buffalo milk, no type of milk. Beyond 2 years, you build the baby's foundation for leading the life and have their best start of the life. So eating healthy is very important for mother from the day they know that they are pregnant. Okay, so they have to have balanced diet, they have to be stay healthy, uh, don't have any type of sedentary lifestyle, because sedentary lifestyle actually increase the chances of lifestyle disorders. So stay active, stay hydrated, introduce healthy activity in the after the in during the third trimester. You have to introduce healthy activities. Okay, breastfeeding earlier, start early breastfeeding, and up to 2 years definitely have the breastfeeding. Okay, so this is very important. Along with the 1,000 days, first 1,000 days, we have to have a supportive community activity or workplace. So where the mother is working, they have an area where they can pump their breast milk. They have an area where they can take the baby. They have community lactational consultant. With that, they have like separate desk where their colleagues are helping them for various work. So this postpartum depression can be reduced with the help of these things. So support is very important. Your familial support, along with that your community support, is very important. Now we have to check the maternal benefit. So what are the maternal benefit is giving? Usually uterine contraction is there, reduce postpartum bleeding, aids weight loss, emotional well-being, and convenient and economical. So it is very easy, anywhere, any place, any state, a mother can feed the baby. So it lowered the risk of type 2 diabetes. So if a patient have developed gestational diabetes, so it has been seen that with breastfeeding they reduce that chances of type 2 diabetes. Lower the risk of ovarian cancer. So each year of breastfeeding lowered the chances of ovarian cancer. Lower the risk of breast cancer. So exposure of estrogen, which promote the cell differentiation in the breast tissue, so it lowered the risk of breast cancer. So more you breastfeed, your chances of lifestyle disorder will be reduces. That's why World Breastfeeding Week is celebrated. So in this way, um, you have to understand that breastfeeding is very important, economical, sustainable, along with that environment friendly. So why you are not breastfeeding? It is important. Why mothers are moving to the formula feed? So you have options, you have community support, you have workplace support. So with that you need this. Now what are the challenges? First one is poor latch. If baby is not properly rooted into the nipple, properly sucking reflex doesn't develop, so poor latch. So what happened, don't get enough milk, so they try to correct the positions, they try to suck more, and there will be cracked nipples, there will be means improper milk secretion will be there. Okay, sore nipple will be there, so pain in the nipple, infection in the nipple. So these are the we have observed. Engorgement, we have seen that the breast feel hard, swollen, heavy. When this heavy with the milk, you have to means you have to pump few of the milk and throw it out, or you can feed the baby with the bottle, your breast milk, because it is difficult for the baby to suck if the breast is full with milk. So some options for the poor latch, you have to have a proper positioning, proper routing is important. For sore nipples, you have to apply ointment, or those ointment which is not harmful for the baby, or you have to change the breast and give them feed. Okay. For engrossment, I already discussed. Just pump the milk and put it into a bottle, and you can feed with the bottle also. But I will not recommend, because in the initial stage, what happened, baby will think there's a nipple confusion will be there. Either they will not take the milk, or they will take it and they like it very much. Okay. So these are the challenges we actually see. But if you're having proper rooting and proper sucking, the breast milk will be actually not challenging. Okay. So now some common low supply of milk is, I already discussed that these challenges are for mother. So what happened, we see that if a mother is working, they usually give formula feed. I have to pump it, I have to store it. It is a very means they have to work hard. Okay. So and low supply is occurring when there is more age. Okay. 45 years, 40 years of mother, so there is a chance of low supply, so they usually have to give the formula feed. So there is a no such other option. So general tips, what we think, that you have to go for who guidelines. That is, you have to feed the baby on demand. Proper rooting and proper sucking is important. After introducing the complementary feeding, you have to start your day with the breastfeeding, then give a complementary feed, then in between do the breastfeeding, and after that also give the complementary feed. Like that you have to introduce, and up to 2 years you have to do the feeding. So World Breastfeeding Week is actually providing awareness regarding various things. We actually having various myths. Okay. Because science is not that much developed in the past years, and by hearing they are making some stories with that, also carry on these sessions. Okay. So that why this session, these types of workshop is conducted by WABA along with the WHO and UNICEF to give them knowledge regarding exclusive breastfeeding. Okay. That's all for this session. If you have any doubt regarding the session, you can ask me.
Ma'am, after 2 days of postpartum, we can give sprouts to them.
2 days of
Postpartum.
2 days sprouts to whom? Just give me a 1 second.
Hello,
Yes, yes, I'm listening.
ma'am. Two lactating mothers.
Oh, lactating mothers. If they can
Yes, ma'am.
digest it, if there is no digestion issues, they can have it.
Okay, ma'am.
Any more questions? Yes, Medha.
Generally, I face this question that when we start with, like after 6 months of the baby turns 6 months, ma'am, little bit of water, mild water is allowed or not?
Yes, little bit of water you can give them, because you are giving the food, right? So there will be
Yes, ma'am.
choking or there will be issues. So you can give them little bit of water.
Like, ma'am, we can start with dal water and all these things, no, ma'am.
Don't start
So
with
already water we,
water. Give them
huh?
dal. Why water? Dal you can give them itself.
Okay, okay, ma'am.
Any questions? Okay. Okay, I hope there is no questions. Thank you everyone for celebration of this World Breastfeeding Week.
Hello,
Yes.
ma'am. Any formula milk can be given after 6 months, or normal home food is best against with
See, you
breastfeed.
have to introduce the food after 6 months. Okay. Along with breastfeeding. If the mother is not available, if mother can't able to store the breast milk or pump the breast milk, then you can give the formula milk. If there is no option, then you can introduce the formula milk. Any more
Like
questions?
like you already mentioned, ma'am, no? The exclusive breastfeeding up to the 2 years, ma'am, right?
Yes, yes.
May I consider it at least 3 months uh, instead of 6 months exclusive breastfeeding?
See, if there is issue, then you have to consider that. Otherwise, exclusive breastfeeding is up to 6 months. Okay, thank you everyone for joining the session.
Thank you, ma'am.
We
Thank
will
you.
end the session now.
Thank you, ma'am.